Well, welcome everybody. I hope you're all caffeined up. My name's Donna Edman. I'm the CEO of Astute Advocacy, and I'm a long-standing supporter of an ethical medicinal cannabis sector here in Australia. As Peter Crock mentioned, MCIA's had it greatly appreciates the constructive and candid relationship it's had with Professor Skerritt and the TGA more generally. And it's a tremendous sign of goodwill to have two representatives from the Australian Government with us today. Adjunct Professor Robyn Langham, AM, is the Chief Medical Advisor to the TGA, Therapeutic Goods Administration. She's a nephrologist and a clinician researcher who spent much of her career in public hospital service as a director of the renal unit at St Vincent's in Melbourne, and subsequently as an academic and as the head of the School of Rural Health at Monash University. And she's currently also the chair of Human Research Ethics Committee of the Royal Children's Hospital, and amongst other roles is on the board of the Australian Medical Council. So she mustn't sleep much. Welcome, Robyn. And Danielle Chifley is the director of the Medicinal Cannabis section of the Office of Drug Control, and returns once again to Cannabis. She's an experienced lawyer in public administration, regulation and policy, but most importantly and of significance to this room, Danielle's played a key role in the development of regulation for medicinal cannabis and therapeutic goods. Welcome, Danielle. So I'm going to ask Robyn and Danielle some questions in turn, and I encourage you to use the app to raise some questions from the floor. So if I might start with you, Robyn. You're coming up to your first year as Chief Medical Advisor to the TGA in June, and that's after 6 years, by the way, on the TGA's Medicines Advisory Committee. With the backdrop of COVID-19, it must have been one hell of a ride. Could you talk a little bit about your role and how it applies to medicinal cannabis? But importantly, what kind of issues do you get engaged in, and what are you hearing as a regulator?
Thanks, Donna, and welcome everybody. Could I just, I know this has already been done here this morning, but I do personally feel the need to acknowledge the traditional owners of the land here, the Wurundjeri people of the Kulin Nations, and pay my respects to any elders past, present and emerging, and also any members of the Aboriginal and Torres Strait Islander community who are with us today. Thank you. My role as the TGA, as the Chief Medical Advisor, is to, I guess, jump in and it sounds stupid, give advice, but to help out any of the other hardworking teams of the TGA where there is a medical concern about really any of the issues that the TGA deals with. And that can be to do with post-marketing surveillance of devices, it can do with pointy-end decisions around regulation of newer drugs, and any sort of clinical issues that might arise in the field of medicinal cannabis. So I'm sort of in and out of a lot of different problems.
And what's coming up in particular that's catching your attention?
I guess from the medicinal cannabis perspective, what we're hearing from clinicians in the area at the moment is predominantly around the use in paediatric populations. There's, I think, still a huge dearth of evidence about how best medicinal cannabis, how safely medicinal cannabis can be used in children. There's certainly a lot of concern about the potential for THC-containing compounds to be toxic to the growing brain. And in fact, that might even be permanently damaging to the growing brain. So balancing these concerns that we're hearing, obviously, with the potential utility in paediatric populations of children who are in desperate need, or children and their families who are really in desperate need of some sort of therapy for what is often quite severe behavioural disorders. So that's really where I've been spending most of my time in the medicinal cannabis area of late.
And then you would engage with clinicians about what they need to make those calls?
Well, it's in part clinicians, it's also the patient groups. None of us would for a second want to diminish the need of a family who has a child with severe self-harm behavioural disorders and the potential role of medicinal cannabis products there. But it's how, I guess, we regulate and how we protect against overuse of THC-containing compounds for children who perhaps aren't benefiting from them.
Yeah, thanks, Robyn. When we were talking last week, you also mentioned the notion of one-stop shops and that you were kind of had some concerns, or there were some pitfalls around that. I wondered if you could elaborate a little bit about that.
Yeah, so again, this is something that's coming from the clinical community, from the AMA in particular, and it's something that the medical board is currently looking at, the role of telehealth, the role of clinicians who prescribe and interact with patients without any face-to-face consultations, without any real-time communication, interaction, if you like. And I think the medical board is still finishing its consultation process on that. The sort of online, and it's not just medicinal cannabis, but the online GP practices, the online get drug A practice, where there is a risk that patients can access and log on and tick boxes, and you know, the concern is that sometimes this might even be some sort of AI algorithm that allows them to then order drugs that are then delivered by mail. And I think it's clear even before the consultation is finished that I think the medical board is hinting that perhaps they would take a very dim view of this sort of practice. So, you know, the clinician regulation is not our area at the TGA, but and that's more the Medical Board of Australia and AHPRA, but I guess we have sort of been loosely involved in contributing to that discussion as it pertains to drug safety.
Thank you. I was wondering if you could paint a picture or update us a little bit about just broad trends in terms of the SAS and authorised prescriber scheme, just in terms of demand and you know, where you're seeing some of the change.
Oh, I'm not sure I'm the right person to answer that one. I know, as everybody who's able to access the online dashboard can see, that it's certainly growing, and the number of authorised prescribers is growing, and the number of prescriptions is also growing. But in terms of specific areas, I couldn't help you. Sorry.
That's all right. With regard to the reporting, are you getting any feedback from authorised prescribers about how they're managing that? Is that kind of the 6-monthly reporting on patients? Is that with all the other demands and burdens that are in primary healthcare at the moment, is that problematic, or is it being managed pretty well?
I'm not getting anything negative back.
Right.
Understanding that the role of the authorised practitioner here is to undertake to do that.
Yeah.
And if they're not able to continue to have that ongoing discourse with the TGA in a reporting sense, then perhaps it's time for them to no longer be an authorised prescriber, or to look at their role in that field. It's very much about ongoing reporting and contribution of abnormal effects, adverse events of patients, in order to provide that level of security.
We've got a couple of questions here. One of them is, lately we are seeing an increase in CBD use in renal patients, and could you please advise with regard to the safety with CKD and renal transplant patients, and also with dialysis patients? You able to comment at all on that?
So again, this is a difficult area for anyone from the TGA to comment on, when there's not been a large range of formal clinical trials, and there's, again, we're really working in an evidence-free zone. So personally, I'm not an authorised prescriber. I don't prescribe CBD to my patients, but I can see how, for a number of my patients, the ongoing burden of symptoms with pain and neuropathy, and certainly nausea of end-stage kidney disease could prompt some of them to try and seek out some support in that area. But I certainly couldn't comment on the validity of it, or the research background. In terms of renal transplant, no, I know of no work in that area myself.
Okay, thank you. Under Professor Skerritt's leadership, the TGA has been an active driver in international harmonisation of regulation for therapeutic products, and this might be also something that Danielle can comment on, but it's also come up a little bit in the last session in terms of where Australia sits relative to other jurisdictions in terms of medicinal cannabis regulation. Danielle, are you able to comment perhaps?
No, I'm sorry, I didn't catch that part of the last session, and it's probably not something I'm in a position to talk to in terms of how Australian fares by comparison to other jurisdictions internationally. Other than to say that the design and implementation of the Australian regulatory scheme is intended to implement Australia's obligations under international drug treaties, and in doing that we do try to make sure that we do that effectively to make sure that we're maintaining our good standing internationally, but in terms of specifics, in terms of comparative international regulation, I'm not able to speak to, sorry.
Yeah, sure.
I think it's really interesting what's going to happen with the US FDA over the coming months. As some of you may know, the US FDA recently declined a petition by, I think, 3 different parties to have medicinal cannabis regulated as a food. And I think their latest statement is that they really can't see that medicinal cannabis in the US can be managed under any of their current frameworks, and they are seeking to construct a new regulatory framework that would meet the needs of medicinal cannabis suppliers and users. So, I think there's a lot of flux happening around the world. We certainly don't have any plans to change or to tip things on its head at the moment, but I just think it's really interesting to see how the rest of the world is moving to sort of, whilst meeting the needs of patients, but still doing so in a sort of an evidence vacuum.
And authorised prescribers, are they talking to you about the issues of cost burden and what that means for how they engage with patients?
We're hearing a lot of talk about the cost and the overwhelming cost. That unfortunately, again, that's not anything that we can necessarily help with. One of the, I guess, most precious things about the role I find myself in is that I don't get involved with PBS or any sort of other cost supporting roles, which I guess is how it's easier for me to worry less about my job. But certainly we're hearing a lot of talk about the cost and how that needs to be supported. Yeah.
Danielle, I was just wondering if you could comment on the consultation that you've been undertaking most recently with the industry with regard to regulatory fees and charges. So it's going to be of interest to a lot of the people in businesses in this room, and be interested to understand what are you actually sort of hearing as a body, and have you got some early thoughts about how you're going to be responding to the sector?
Sure. The Office of Drug Control, as many of you here would know, has recently undertaken a public consultation process following a review of the fees and charges that are applicable to medicinal cannabis regulation. We had a consultation paper that was published in December, and it closed in early February, and throughout that process we had 2 public consultation webinars that were really well attended by a broad range of participants, and we had a small number of written submissions as well. The review process and the need for it, just for those who are less familiar with it, the Australian government, as a matter of whole of Commonwealth policy, has a charging framework, the Australian Government charging framework, that provides that the costs of regulatory activity should be borne by the industries that are regulated. So the medicinal cannabis fees and charges framework needs to comply with the Australian Government charging framework, and when the cost model that we currently have was established, when the scheme was established, the fees and charges were set at that time in terms of the cost model and the approach. And although it was considered fit for purpose at that point in time, there's been a lot of change since then. We have had the extension of the fees and charges framework in 2020 to extend to manufacturing activities, but in terms of a holistic review of fees and charges, it was appropriate to do so last year, which is when we undertook the review, following the significant reforms we had to the medicinal cannabis framework, following on from the Macmillan review in 2019 and the implementation of the single licence changes and the changes to our permits framework. So the objective of Australian government cost recovery is to make sure that we're recovering the efficient, effective costs of regulation. And so what that means is we can't just sort of pluck a number out of thin air. We have to do it on the basis of activities-based costing principles. So we look at all of the activities that we undertake, and we look at the period of time that takes and the tasks that are undertaken, and that generates the cost model activities. So we have done an extensive review now that we've finalised the implementation of those significant reforms, and the revised fees and charges that are proposed to be implemented were set out in that consultation paper. In terms of feedback, one of the changes that we've proposed through those changes to fees and charges was to more clearly categorise the types of applications that we receive. And in doing so, that means that the costs for those applications are really tailored to the amount of work effort that is put in delivering that activity. And so we have, through this review process, more clearly delineated the most usual types of applications that we need to make, for example, in terms of licences and permits. We've also more clearly identified the types of inspection and compliance and monitoring activities that we undertake, so that we can have well-targeted price points for those. And so really that's the revised framework. And we've had, through the webinar sessions and the consultation process, quite positive feedback about the clearer categories of costs and more tailored approach to those categories. There was a couple of questions about how that would be implemented in practice, and being able to, have clarity around the implementation of that. And there'll certainly be, if the proposed fees and charges are accepted by government, then there'll be more information about that as it's implemented. But we do thank those people who have taken the time and effort to participate in that consultation process, and particularly those who've provided feedback and submissions to us, because that's been a very valuable experience for us.
Thanks, Danielle. I mean, the ODC's expanded pretty quickly, or needed to, over the last 5 years, and I think one of the speakers in the last session said that the New Zealand equivalent is pretty tiny by comparison. I mean, how many people are now working in the office, and where is the most effort being put at the moment?
Well, the Office of Drug Control obviously is broader than just medicinal cannabis. Medicinal cannabis is a very large part of our work. We have around about 40 people in the office, so that does vary a little bit, and we'll be doing some recruitment very soon, I'm pleased to say. But in terms of the comment that you made around the need to expand significantly, I'm not surprised that there's some other jurisdictions overseas who are having that challenge. I joined the Office of Drug Control Robyn was asking me this morning, I thought, oh my Lord, it's longer than you'd expect. late 2019, after Professor McMillan did his review of the regulatory scheme at around the 2-3 year mark. And one of the significant challenges of that at that point was the sheer volume of work that the office had, which had arisen in the very short period of time since the scheme was established, and the real challenges faced by resources needing to cope with that volume of work. So across the last several years, we have put in a lot of effort to be able to try and meet those resourcing demands and get through obviously those volumes of work, and we're having really good success in that outcome, combined with implementing the recommendations from Professor McMillan's review. One of the things that we are looking forward to now moving forward is to have greater stability around the office and our resourcing profile. You would be aware that I think a little over 12 months ago, the Office of Drug Control expanded to have a dedicated monitoring and compliance section. I'm really pleased that my colleague Danny McQuillan, I'll give you a shout out, is with me here today. So I'm sure you can touch base with us if you're interested afterwards. But that does show that the maturing of the industry has meant that it's important for us to be able to proactively monitor and, when necessary, respond to compliance issues through our inspectorate that the section administers, and through a range of other monitoring and compliance activities. So we really, although much smaller than the TGA, obviously have to grapple with the broad range of issues that any modern regulator deals with.
Thank you. Relating to that is also the reporting side of that, and whether there's an agenda for digital transformation and how you're kind of wanting to revamp your website. And I think there's a lot of interest in live reporting of the status of submissions. Are you able to comment on any of that?
We would love to be able to be in that position, and I'm sure many people in the room would love for us to be in that position as well. It's a great question. Towards the end of last year, the Office of Drug Control engaged a service provider to review the current state of the Office of Drug Control, and particularly looking at our business systems and digital profiles and resources, and to advise us on a proposed future state for our business and systems platforms. And that work was undertaken by Deloitte, and they made a range of recommendations, most of which involve significant digital transformation to be able to put the Office of Drug Control in the position to be able to really robustly administer the framework that we've got, and to provide services to the industry in a much better and more dynamic way than we currently do, where a significant number of our activities are highly manual in nature. And so that was an exciting piece of work for us. Having said that, most of those recommendations, particularly requiring significant digital reform, will require additional funding from government. Having said that, if that's something that can be achieved, it would certainly, like the digital transformation that the Therapeutic Goods Administration has been undergoing, and other parts of the Department of Health, will certainly put us in a really good space to be able to proactively engage in our regulatory community in a more dynamic way. We have had some very recent success in relaunching the Office of Drug Control's website. So very late in November, we launched our redesigned website. That piece of work closely followed on from the relaunch of the TGA's website, and certainly in the last couple of months across that period, we've had some pretty positive feedback particularly around its usability, its ease of use on handheld devices, for example, ability to find information and align with sort of the design and look and feel of the TGA website. We really like it because it's more clearly articulates the roles and responsibilities of the Office of Drug Control, and it creates an opportunity for that website to be maintained and expanded across the ODC's activities. We will be continuing to look at the content on there across the coming months. Very soon we'll have some revised information about our monitoring and compliance activities up there, so keep your eyes out in the near future, and you'll see more of that. And that's part of our work program to continue with that. So for a start, it's easy to find stuff, and we'll be working to expand and develop on that in the near future.
Thank you. I think there's a question there about is there any consideration being given to the current import burdens that require new import certificates each and every batch that's imported? So I think there might be a few questions about the level playing field as well for importers.
Jenny Bunnett's speaking later on today about GMP, so that might be a better platform for her to answer on the new GMP requirements.
Yeah. Okay. And there's another question there. Is there any consideration of a separate licensing scheme for cannabis research labs, separate from the medicinal cannabis medicines manufacturers?
That might, it's a bit hard to tell whether that question falls into the TGA manufacturing space, so it might be one that Jenny can return to. What I would say though, in terms of the licensing framework that the Office of Drug Control administers, is that we previously had multiple separate licences for discrete activities. Part of the implementation of the recommendations of the Macmillan Review was to simplify those arrangements, and we no longer have a discrete research licence relating to cultivation activities, but I suspect that question was more around manufacturing research activities. So,
thanks. I know Robyn's memorised a question that was earlier that has fallen off the screen, but...
Well, there's a question about the sorts of evidence that the TGA accepts for drug regulation, and specifically a question about N=1 protocol. So one patient, give the drug, see what the outcome is. Certainly the TGA, like other regulators around the world, has accepted the true value of other evidence bases other than randomised clinical trials. And they are perhaps, I think, most commonly used at the moment in the post-marketing space in terms of surveillance, where you have electronic medical records, where you have registries and other databases. In terms of drug regulation, though, however, for a drug to be registered in Australia, our legislation really requires us to be reassured that the full and appropriate and robust randomised clinical trials that demonstrate safety and efficacy have been undertaken. And that's not to say that a body of real-world evidence might not be able to sit alongside that, but I think at the moment, for where our legislation is, there really is not any way that we could undertake a registration process for a drug without the necessary body of robust randomised clinical trials. We've only had 2 sponsors come to us for registration of their product, one of course being the one for the rare childhood epilepsy and the other being for spasms in multiple sclerosis. And they're the only 2 clinical conditions for which randomised clinical trials have demonstrated good efficacy that sponsors have brought to us. So we would really welcome other sponsors to bring their product to us for registration, but there is, according to our current legislation, a need to be able to demonstrate efficacy and safety. So I hope that answers the question.
Speaking of sponsors and submissions, is there any advice on that either or both of you could give about things that industry or the sector or individual sponsors could be doing a bit better in terms of their submissions? Are there any common mistakes that you see, or things that end up taking a lot of time in terms of resubmission that could be avoided?
We don't have any submissions. I guess that's
from your point of view.
We'd like to see them.
Yeah.
But
okay.
Understanding that in order to get a product registered, there's the requirement for that level of evidence. So we're not actually seeing submissions from sponsors at the moment. Hence the SASB program, which we use in order to be able to allow patients to access unregistered products.
Right. Last week in the Parliament, we actually had a fair bit happening in terms of TGA legislation. I think that TGA would have had a pretty busy week, changes to its remit. But importantly also, there was a conversation in the Senate with regard to Green Senator Jordan Steele-John raising the issues of access to medicinal cannabis, and then a private member's bill was introduced called Access to Medicinal Cannabis by One Nation Senator Malcolm Roberts, that was sponsored by Senator Pauline Hanson. I know you can't comment on government policy, but you know, what's the process in terms of advice that you would give to either government, or are you basically waiting to be called upon by any parts of the system in terms of those senators sponsoring a bill, in terms of the detail that might sit behind it at all? Do you get involved in that at all?
Well, I could probably touch on that very briefly and very generally. A private member's bill, this particular bill is a private member's bill, as you indicated. In terms of the advice to the member that proposed that private member's bill, they would have a range of services as being a Member of Parliament, including Office of Parliamentary Counsel would assist in the drafting of the legislation. But the department's role when it's a private member's bill would be to, like any other piece of legislation, advise our minister if required. So can't speak to the specifics of that legislation, but in terms of advice about that bill, I'm not sure what a private member's bill would, additional advice that was sought by the member in proposing that bill, but our role is to support our minister in relation to any consideration of issues that the minister seeks advice from the department from.
Thank you. I mentioned earlier that Robyn mustn't get much sleep given how many roles that she has, but there was a question here about, you know, what are the most significant issues that might keep you both awake at night with regard to medicinal cannabis? What's most topical, or what most, you know, on your mind with regard to things and challenges that need to be resolved?
Look, I guess I'm not sure that it quite keeps me up at night, but one thing that I would say is that we have been, as I mentioned before, with our dedicated monitoring and compliance section, we've been, and particularly post-pandemic with the travel restrictions, etc., loosening up across all states and territories. We've certainly been very proactive out in the industry, attending sites, visiting licence holders. We have been proactively trying to take a more agile and proactive approach to engagement with licence holders during regulatory assessments and at other opportunities for engaging with them about future plans. And through those activities, it is pleasing to note that generally speaking the industry is pretty compliant with the regulatory framework, certainly what we're seeing across this financial year. In saying that, we've had 26 inspections on the ground in the industry across that period. So we're really pleased because as the regulator, what we actually want to be seeing is that industry participants are identifying and appropriately managing issues and risks as they arise, that they are engaging with us when they need to, or if they're unsure about something, so that we can support them and assist them in making sure that they are compliant with the framework. But importantly, in the rare circumstances where, and there are some circumstances where it's appropriate for us to take more direct activities, for example, through engaging on bespoke issues of concern or through issuing infringement notices, for example, then we're able to bring industry participants, which is our objective, into conformity and in terms of better practice. So that's pretty good from our perspective, from what we've been seeing across this period. Having said that, the things that we are seeing across the last 6 months or so, we're seeing a number of licence holders looking to make some significant changes in terms of their own operations, whether that be in terms of their governance or ownership arrangements, or in terms of changing or adding additional sites. What I would say to you, if you are considering significant changes to your operations, please reach out and contact us. It is good to engage with us early about plans as you're working them through, because we can certainly provide you with information about how to make sure that you are appropriately approved or maintaining appropriately regulatory compliance with your obligations as you proceed through your own changes. And also, it might be that we actually need to come out and see you and work through circumstances or issues on the floor. So we would encourage you to reach out early, and at least we can work with you to try and achieve the objectives that you are looking to achieve in a manner that is compliant with the regulatory framework, which is our obligations.
Thanks, thanks, Danielle. We've run over time, and there are some questions that we didn't get to, but Danielle and members of her team are going to be here for the next couple of days. Robyn, unfortunately, has got to belt back to Canberra, but please join with me to thank both of them very much for joining us today.